Blood is an especially precious fluid in our arteries. It transports nutrients and oxygen to the individual cells in our body and removes the metabolic waste to the detoxification organs. In other words, the blood flow in our blood vessels is essential for life, although the correct mixture and amount is crucial. The red blood cells, or erythrocytes, are responsible for the transport of oxygen. White blood cells, or leukocytes, for the defense against diseases. The blood platelets, known as thrombocytes, create blood clots. In this way, they can prevent, for example, a wound in the blood vessel from bleeding too much and causing death. These blood cells have special features on the surface that are characteristic for each person. If a foreign blood is given through a blood transfusion, the body recognizes it as such and starts a reaction. These days, we know that these reactions or changes to the immune system due to the foreign blood can be a middle or long-term trigger for a higher death rate or cancer. In the short term, it can cause recurring infections, lung failure, stroke, heart attack, pulmonary edema, or shock. The answer? The body's own blood is protected and stored, and the foreign blood transfusion is reduced to the situations where there is no other alternative. This package of measures is called Patient Blood Management, or PBM. During every operation, blood is lost. With a small operation, this is not disturbing, but with a big operation, it is a different picture. So much blood can be lost that the body does not have enough left over. The transport duty of the blood is in danger. This means that not enough oxygen and nutrients are being brought to the cells. Previously, when in this situation, a unit of foreign blood was given. Today, the much safer process of PBM is used. This means that before, during and after a big operation, the attending doctor treats every anemia consistently. They reduce consistently the loss of the patient's own blood and only give foreign blood when it is really indicated. PBM is orientated to each patient. That is individual medicine in its purest form. Why does one go to this much trouble and not stick to the traditional method of giving blood units? Because the patient is in the short, middle and long term better off, even tens of years after the operation. The motivation is the improved results, known in modern terms as patient outcome. That PBM also helps to save money is a welcome side effect. Economically speaking, more blood units are available for the patients who really need them. And PBM is also suitable for cancer treatment. Why should you, as a layman, know about PBM? Because it is about your own health and we need your assistance. In addition, you should know what to expect from the health service. The reason for this public information film is participative medicine. This means you should be capable of making medical decisions together with your doctor. The modern term is patient empowerment. Big operations need PBM. How do you define which is a small and which is a big operation?
A big operation is a surgical intervention where we can expect an adult to lose a half to 3/4 of a liter of blood. This would be the case in heart surgery, a large surgical intervention to the stomach, replacement of a large joint like the hip or knee, or the stabilizing of the spinal column. PBM should be used in these operations.
Bei diesen Operationen sollte man PBM anwenden.
The preparation for a big operation starts days or even weeks before. Possible additional infections and risks are investigated. This is carried out in a pre-anesthetic outpatient's clinic in the hospital, or the ordination for general medicine or internal medicine. The patient is examined to see if they have enough red blood cells or hemoglobin. This is done with a blood count. Hemoglobin is shortened to HB on the lab results and must be over 13 grams per deciliters. Otherwise, the patient is considered anemic. A finger clip can be used to test the hemoglobin levels without even pricking the skin and removing blood. However, this is only to be used as a general guide. If the patient is diagnosed with anemia, the cause must be identified and removed. The doctor will order a blood test. The blood test is increasingly carried out to the same recognized national standard. Anemia is not rare. About a third of patients are anemic, and the risk rises with age. What is now your responsibility as a patient? You must go to additional blood tests and discuss the results with your doctor. The type of individual therapy subsequently used will depend on the results. The therapy must promote the production of blood, supplement iron, vitamin B12, folic acid, or the growing factor of the red blood cells, or a combination of these nutrients. Coloscopy may be necessary to discover and repair any bleeding in the intestines. If any causative illnesses are present, like inflammation or infections, these will also be treated. The doctor will decide together with the patient which treatment is to be taken. The most common cause of anemia is an iron deficit. If iron tablets have been prescribed, it will take quite a few weeks to build up an adequate amount in the red blood cells. Also, many people react badly to iron tablets. Iron infusions work much quicker, but some people are allergic, so they can only be carried out under the supervision of a doctor trained in emergency medicine. Information to iron therapy is openly available. As part of the preparation for the big operation, the patient will be questioned about previous illnesses, family diseases, and blood-thinning medication. Blood clotting disorders and blood-thinning medication can lead to a larger loss of blood during the operation.
Gibt es, dass Sie Nasenbluten oder große blaue Flecken haben, ohne dass Sie wissen, wo Sie sich angestoßen haben?
If a blood clotting disorder is discovered, it will be identified and corrected in a similar way to anemia. According to PBM, any blood-thinning medication must be stopped before the operation, or replaced by a medication that has a short effectiveness. The doctor will explain the prescription of this medicine to the patient.
It is important that anti-clotting drugs are stopped at a specific time before the operation. Syndrome and Marcomar, for example, should be stopped 3 to 10 days before, depending on the test results and the consultation with the doctor. The new anticoagulates such as Lixiana, Xarelto or Eliquis must be stopped 2 days before, and it's not necessary to give thrombosis injections. Produxa should be stopped 2 to 5 days before, depending on the kidney analysis, and thrombosis injections also do not need to be given. With thrombo-as or medication containing aspirin, the patient should stop taking it up to 5 days before. In some cases, the cardiologist may recommend the continued use of this medication. There are also antiplatelet drugs like Plavix, Effient, Brilica or Ticlid that should not be taken 7 to 10 days before, depending on what kind of operation is being carried out.
Any damage to the heart, blood vessels or the lungs will also be checked. If any damage is present, the body will have a problem to compensate blood loss. The blood loss tolerance sinks in such cases. This is why PBM identifies causative illnesses before the planned operation. An attempt is also made to improve any chronic problems before surgery. As a patient, you are expected to follow the instructions. Have your hemoglobin levels analysed in the lab and discuss the results with your doctor. You are a participant in your own healthcare. It takes about 8 weeks to successfully reduce the risk of an existent anemia, so the preparation for a planned operation should start 2 months before. When the level of hemoglobin rises above 13 grams per deciliters, the operation is given the green light. The patient enters the OR with a safe amount of own blood. PBM Creed. A patient's wishes and needs play a central role. Patient blood management means that informed decisions are made and openly documented. But which individual measures are we actually talking about during and after the operations with the risk of high blood loss? Generally, a safety checklist is used before the start of an operation, similar to a flight checklist.
Team Timeout. Wir operieren an der Wirbelsäule einen DLIF L3, L4.
Surgical techniques are used that reduce blood loss. The blood vessels are immediately sealed after opening using electric current or ultrasonics. This is an important part of the concept of PBM. Medication is introduced to a bleeding wound, which helps blood clotting in that place, and so helps to conserve the body's own blood resources.
The length of the cut in the skin is not important. What is important is what happens when we are in. We use minimal invasive techniques. When using these techniques, especially when entering the hip area from the front, you must meticulously stop any bleeding, otherwise you can see to operate. This is good for the patient as it reduces the amount of blood loss.
A further important part of PBM is the collection of every drop of blood so that it can be reused. Modern mechanical autotransfusion is used to collect the wound blood, clean it and return it to the patient. The blood is not kept out of the body for more than 6 hours, and the red blood cells work perfectly when returned. This has been proven together with the Vienna Cancer Research Institute.
Wir haben Tests durchgeführt mit diesen gewaschenen roten.
We carried out tests with the red blood cells after they had been washed and discovered that they were malleable.
Sometimes heavy blood loss still happens during an operation. The problem is that evolving anemia is usually accompanied by blood clotting problems, which lead to further bleeding, as the body is not capable of creating clots to seal the blood vessels. The causes depend on the type of operation. Quite often, there is a lack of clot factor number 1, called fibrinogen. A similar problem is the excessive dissolving of blood clots. Both problems can be solved thanks to modern blood clotting therapy. Following the bedside clotting analysis, a concentrate of clotting factor is applied, which compensates the deficit. The excessive dissolving of blood clots can be prevented prophylactically with the appropriate medication. PBM requires the patient to be kept warm because blood clotting works best at normal body temperature, and everyone cools down in an air-conditioned OR theatre. Any changes in the pH levels or electrolytes are balanced out. The anaesthetists are responsible for blood autotransfusion, blood clot therapy and general optimizing during the operation. Effective PBM means increasing the body's tolerance with anemia. This is done through intensive medical technique. The body should be able to function with little hemoglobin and oxygen transport without catastrophic results like a heart attack, stroke, organ failure or death. The anaesthetist can influence this by managing the anesthetics, the muscle relaxant, optimizing the artificial respiration and optimizing the cardiovascular situation. For PBM to be successful, it is important that the strict indication rules for the use of foreign blood are adhered to. From the time of the operation to the release from hospital, blood units are used under scientific standards. Stated simply, as little as possible as much as is needed. PBM does not stop during the operation. Even after the operation, the chance to collect blood is not missed. The blood clot therapy and raising the anemia tolerance are also continued, adjusted to the post-operative situation. It is made sure that no secondary bleeding occurs. The iron deposits are refilled because during heavy bleeding, iron is lost. An iron infusion is used. The required dose is individually controlled, just as it was before the operation. PBM goes as far as stipulating the use of small test tubes for all lab tests. This ensures that the blood stays where it is supposed to be, in the body. Patient blood management belongs increasingly to standard hospital practice and to ISO certification of OR areas.
We of the Patients Advocacy have supported patient blood management for many years, because on the one side it supports the health workers in giving a high-quality blood transfusion, and on the other hand it gives the patients the security of less complications and a good outcome from the treatment.
This video has hopefully explained PBM in big operations in a comprehensive way. Our goal was to create a patient guideline, an addition to the medical guidelines regarding PBM that are of a nationwide quality standard. Additional information can be found in the patient forum of the Austrian Society of Anesthesiology at www.oegari.at.